Dr. Aaron Kheriaty, who is a professor of psychiatry and human behavior at UC Irvine and suing his school over vaccine mandates. I'm going to let you first introduce yourself so we know everything about you first, and then we're going to go into the news here. I'll show everybody your story, which is probably gone international, not just national at this point. But here you are. So, Dr. Kheriaty, tell us about yourself. Who are you? What do you do? And then we're going to get into the controversy over the lawsuit.
Sure, Allison. Thanks for having me on to talk about this issue. As you mentioned, I'm a professor of psychiatry, so I'm a clinician and a teacher in academic medicine, and that's what I do with about half of my time. The other half of my time is my other role at University of California, Irvine, which is directing the medical ethics program there. So I run the ethics consult service and chair the ethics committee, and so about half my time is spent doing medical ethics, bioethics related work. And the other half of my time is being an academic physician, specifically in the field of psychiatry. So that's a little background on me. And as you mentioned, I decided after a lot of reflection to challenge the vaccine mandate at the University of California, not just University of California in Irvine, where I work, but the entire UC system. So that would include all of the campuses and all 5 of our hospital systems. And the legal challenge is on behalf of people that have already been infected with COVID, with SARS-CoV-2 virus, and have recovered. And we can get into the reasons for that, but basically, in a nutshell, what I'm arguing is that as someone who is COVID recovered, I have immunity that is equal to, indeed, it's actually superior to the immunity conferred by a vaccine. But for purposes of my legal case, my legal argument, all I have to establish is that it's the equivalent of the immunity conferred by the vaccine. We know, in fact, that it's more robust and it's more durable. It lasts longer than the immunity from vaccines. And so by not allowing me back on campus and threatening basically my job and my livelihood and my career with this mandate, I'm being discriminated against unjustly. My form of immunity is not being counted, whereas someone who gets a vaccine and has a different form of immunity, even a form of immunity that is not as robust or long-lasting, is permitted back on campus. So the lawsuit is in federal court, and it's a constitutional challenge. I'm challenging this mandate under the Equal Protection Clause of the 14th Amendment. And not to get down into the weeds on the legal aspects of it, but basically all of us are guaranteed equal protection of the laws under the Constitution of the United States, and unjust forms of discrimination that have no rational basis will not pass constitutional muster. And so that's sort of the legal case in a nutshell.
Okay, so if I understand correctly too, when you're arguing that your immunity is superior to those who have been vaccinated, according to even this article here, which I'm actually shocked to see they quoted this, an Israeli study which was published last week and hasn't been peer reviewed, shows uninfected vaccinated people are around 6 to 13 times more likely to get a future infection than those who are unvaccinated and recovered from COVID-19. So when we're talking about that, then I guess what you're also arguing is that because of your immunity, you are less likely to transmit as well, right? Because that's what this is all about. It's not, I don't know if the school or anybody really cares necessarily that you're going to be better off in the future, but that you're less likely to spread it. So is that a part of your argument as well?
Yeah, that's a great question, and you're exactly right. So the issue when we're talking about a vaccine policy, the policy which is supposed to apply to everyone or to large populations is not primarily about each individual. It's about the common good. It's about the collective. And so one counter argument to my claim is to say, okay, Dr. Kheriaty, you may not personally benefit much from the vaccine, but what about other people? Doesn't it make sense for the sake of other people to make sure that everyone is vaccinated. Now, that argument would have, I think, more force. It would be more compelling for vaccines that are what we call sterilizing vaccines. What I mean by that is some vaccines are capable not only of preventing me from getting sick or lowering my risk of, when I get infected, of having severe symptoms or being hospitalized, which is what the COVID vaccines do. But in addition to that, some vaccines prevent me from getting infected at all, and also prevent me from infecting other people, prevent the transmission of the virus. Unfortunately, none of the COVID vaccines do that. None of the COVID vaccines are sterilizing. So while they may reduce the risk of severe symptoms, they may reduce the risk of hospitalization, they do not prevent transmission. The CDC has admitted that someone with a breakthrough infection who is vaccinated is just as likely to transmit. They have just as much viral shedding as someone who's unvaccinated and gets infected. So that argument, do it for the sake of other people, doesn't work, I think, for the COVID vaccines. It may work for sterilizing vaccines like the measles vaccine. Measles is extremely infectious, very, very easy to transmit. So thank goodness we have a vaccine for measles that can prevent not just people getting sick from measles, but can also prevent people from transmitting measles. If the COVID vaccines work that way, that kind of argument, I think, would be stronger. But given the fact, given the empirical realities of what we know about these vaccines, that argument really falls apart, and we have to fall back on what are the individual risks and benefits for the person who is going to be receiving this vaccine. And that's why I think arguments from bodily autonomy, arguments from informed consent, and the right of informed refusal are really central when we're talking about the COVID vaccines, because those arguments for the common good just lose their force in a situation in which the vaccine doesn't prevent transmission. And I think this is overlooked in a lot of the arguments. A lot of the folks that are commenting in the media or commenting publicly on the vaccines assume that the vaccines are going to prevent the transmission of the virus, because that's the way other vaccines, at least some vaccines, work. But if you dig into the actual research on these vaccines, you see that that's not the case. And so I think that's a common misconception that it's important to clarify. One other counter argument to my case that I think is important to clarify is the argument that goes like this. Okay, your immunity, Dr. Kheriaty, is very good. Your natural immunity is very good. But couldn't we possibly, I will even grant you that it's better than the immunity of someone who's vaccinated and hasn't had COVID. But even so, can't we make your immunity just a little bit better by still vaccinating you? And that's an interesting argument. But it turns out, again, when you look at the research on natural immunity is so effective that a vaccine doesn't change it very much. When your immunity is already 99%, according to most studies, giving an additional dose of a vaccine, this was actually tested in the Israeli study that you referred to earlier, this exact scenario. Your immunity went from like 99.7 to 99.8, right? So when your immunity is already that good, it's really hard to make it any better. And I did an analysis I just published today on my Substack blog. If folks are interested, they can look it up there, of looking at basically harms and benefits. And what I try to show there is that you'll have to harm more people by vaccine side effects just to prevent one asymptomatic infection. And the risk benefit ratio for already immune, naturally immune, COVID recovered people just doesn't pan out in this case.
This is it, correct?
There you go.
Okay.
And it's the second post there on vaccinating COVID recovered individuals. If your listeners or viewers are interested in the details of that argument, that's where they can find it. I do an analysis called number needed to harm and an analysis called number needed to treat. And these are helpful numbers to wrap your head around statistics and make them clinically relevant, because when you start talking about percentages, it can be very abstract. Number needed to treat basically says, how many people would you need to vaccinate before you prevented one infection? Number needed to harm would be, how many people would you need to vaccinate before you harmed one with a clinically significant side effect? And what I do in this piece is run that analysis based on the Israeli data and show that the number needed to harm is much lower than the number needed to treat, even to prevent one asymptomatic infection. To prevent one symptomatic infection or one hospitalization, the number needed to treat is so high that we can't even calculate it, basically. So vaccinating a bunch of people, where I essentially show here, you're going to harm about 75 people with a clinically significant adverse effect, just to prevent one asymptomatic infection. That calculus doesn't make sense. So I think the case for vaccinating individuals who have already recovered from COVID is weak. With that said, I'm not advising anyone to avoid vaccination. I think that's a very individualized choice. If you've already had COVID, you still want the vaccine, you understand the potential side effects of the vaccine, and you're willing to take that risk because it would make you feel more comfortable, no problem. So this analysis is not a piece of medical advice. I think the decision on whether or not to get vaccinated has to be something that each person makes, in consultation with their doctor, and after doing research and looking at their individualized risks of what happens if I get COVID based on my age and my co-occurring condition, and individualized risks of what are my chances of having a potential side effect from the vaccines. So some folks have asked me if Dr. Kheriaty, if you've refused the COVID vaccine and you're suing the university to challenge their vaccine mandates, are you anti-vax, quote unquote?
Right.
And my response to that, Allison, is, that question makes about as much sense to me as asking, Dr. Kheriaty, are you pro-medication or anti-medication? The answer is obviously, well, which medication for which patient or which patient population, under what circumstances? It's just, there's no such thing as a medication that's good for everyone all the time in every circumstance. I think that goes for any medical intervention, including a vaccine. We have to look at population risks. We have to look at individualized risks. And somehow when we start talking about vaccines, that basic principle of medicine and medical ethics tends to get lost. And we want to put people in these kind of all or nothing boxes or all or nothing categories that don't always make sense.
No, and then this particular vaccine at the top of the list of that, and I think it makes the people who are skeptical and concerned about it, even though they may very well have legitimate reasons to be so, I think the people who are like trying to rein them in and be like, come on, and you really should do it for the greater good or whatever the other reasons are, it does the total opposite of what I think those folks want, by not just being honest about the stuff you're talking about, not, and discussing it with a risk reward ratio perspective, and just giving people honest perspectives on choice. And I just think it's so oversimplified, and a lot of the stuff I covered in mainstream news related to science and medicine, I think, is done that way, especially with very controversial topics. in large part because a lot of times the journalists, like they're not really qualified to
Right.
talk about this stuff. And then they also have their own issues with groupthink and being manipulated by the very propaganda that the industry espouses for other people. So I'm curious about that for you as you've been watching coverage of your case. What do you think about it? Have they done a fair job? Have you been labeled the evil anti-vaxxer? What do you think? Because in my opinion, like just to go use that term, there are a little. I just spoke to a college class yesterday about this. I'm not sure I got through to them. It's hard to tell with the masks on. Just looking at their eyes, I'm kind of like
Yeah.
hello, but I don't I don't know if anyone's there. But what I tried to get across to them was that when you're listening, you're watching or reading mainstream news, there are like these trigger words that are used to establish a particular frame through which the journalist is already starting to get you to go down the particular path
Yeah.
they want you to go down intellectually. And so anti-vaxxer is a term used at the beginning so that after everything from that headline, you're already in a particular mindset about the person they're going to describe. And whatever comes out of their mouth, whatever they're quoted, you're already skeptical of it. They set you up
Yeah.
that way. It's the same way they cover, like they'll have the bureaucratic source on their team and they'll put that up against just a yelling mom. I used to see that all the time when we would
Yeah.
cover controversial topics like the
Yeah.
doctor versus the soccer mom, which is totally an unfair fight. So how do you
Yeah.
think that they've done with your story?
It's a great question. And gosh, I mean, we could spend an hour and a half just on this issue of media reporting around science, media reporting specifically around COVID. I have to say, I think so far the coverage has been quite fair and has allowed me to articulate kind of the central argument in my case and allowed me to at least sketch briefly some of the key research that supports my central argument. So I've been edified so far, and the the journalists who have reached out to me at this stage of the case, which is very early on, have, I think, in large part been pretty open-minded about considering the possibility that I might be right, and so that's been edifying. I've also done some long form podcasts and like this or panel discussions where you have a wide range of people with different opinions, but you have enough time to get past just a television soundbite and you can actually have
Mhm.
some back and forth and some meaningful discussion and debate. So far, fingers crossed, I think the coverage has been very fair. It doesn't mean the coverage doesn't include alternative voices or doesn't maybe challenge some of my claims with an alternative voice, but thumbs up so far with the media coverage. Now, one of the things that I've noticed, however, is at least so far in the national news, I would say this is true. Only the more quote unquote conservative or right leaning media outlets in general have taken an interest in my case, whether it's Fox News or Epoch Times, where I've done segments with both of them. When I look at the people who have reached out to me, however, and I've received, it's been actually very edifying. I've received a flood of correspondence, more than I can even read, much less respond to, from people thanking me, telling me their stories, telling me that they're worried about losing their job because of these vaccine mandates, asking how they can help. And if I look at the folks that follow me on social media because of this issue, or the folks that reach out to me and thank me for what I'm doing, it's probably it would be hard for me to imagine a more politically and ideologically and religiously diverse group of people. I mean, I'm talking about folks from across
Mhm.
the political or ideological spectrum, or people that are apolitical and don't fit neatly into our typical categories. And yet I haven't yet, and I think your podcast may be maybe an exception to that, but in general, I haven't yet seen folks in media from across the political or ideological spectrum taking an interest in this. So for whatever reason, this has been tagged as a sort of more politically conservative position, or right wing sort of stance. But but when I look at the folks actually on this side of the issue who are expressing concern about the vaccine mandates, they don't fall neatly into that category. I mean, some of them do, but it's certainly there's a wide range. So I posted recently on Twitter that the real political divide these days, or the real ideological divide, is not left, right, liberal, conservative, progressive, traditionalist, or even Democrat, Republican. The real political divide is between those who do not want and will resist a kind of technocratic biosecurity surveillance regime, of which vaccine mandates are one significant step, and those who are perfectly happy to kind of go along and accept these things that are being rolled out, that are exerting more and more control, more and more surveillance over the population. And you've got progressives, you've got libertarians, you've got traditionalist folks, you've got non-political folks, you got a lot of people who, for whatever reason, look at these trends and scratch their head and say, that's not the kind of world that I want to live in. So it's an interesting coalition of supporters, and I've just been very edified by the diversity of folks that are sympathetic to what I'm up to with this lawsuit.
Before we get to the rest of this video, don't forget to check out my sponsors, AllisonWinePromo.com, AllisonWinePromo.com. You get 50% off of my favorite Argentinian Malbecs and 50% off shipping. One of the new bottles comes from the oldest vineyard in Argentina. These are new bottles from the last shipment. So if you got my last package, these are totally new, but just as good. AllisonWinePromo.com, or you can go to twinenginecoffee.com/Allison, twinenginecoffee.com/Allison. These are high altitude shade grown USDA certified organic Nicaraguan roasts. I like the dark roast, but they have a wide variety. They also have a Kheriaty tea, which is tea made from coffee fruit. So whatever you're drinking, you can support free speech in the process. It's probably no surprise to many people that the legacy news is not reflective of mainstream America or the diversity of Americans. That said, one of the perspectives I have on all that, say if you take censorship for a talking point, for instance, I always ask, like, why these journalists, and I should put that in air quotes, are the ones in many cases cheerleading for speech suppression by these big corporations. Yeah. And I think it's because besides the fact that they feel like somehow they're superior gatekeepers, and then they serve this really virtuous role to keep us safe from information that could harm us. I also think they're just not scared that they're going to lose their opportunity to speak. And so if you are exempt from stuff, or you are at the top of the food chain, you're not concerned like the rest of us, because you get to break the rules all the time. And that's been something I've shown on my own podcast, my YouTube channel specifically. One time I was suspended for showing a CNN and an NBC video and pointing out how their videos broke the community guidelines according to YouTube, and how nothing happened to them. And they proved my point by then suspending me for showing the videos, but they didn't go wipe them from the mainstream, from CNN or NBC's YouTube channel. So literally even the action that was taken against me for pointing out the hypocrisy was itself hypocritical, and showed exactly the point I was trying to make, which is that those of us on the outside are not allowed to we're not allowed to break the rules in the same way that the people on the top are. And so they're just not worried. I think that's part of the problem. They're just not worried. So they don't mind cheering on censorship or control, because I don't think they're worried their lives are going to change that much. But I am curious to ask you about what you think the psychology behind all of this is, because it's a fascinating time if you're not running around frantically hysterical and scared, which is, I can understand why some people are. About where we're headed with these mandates and whatnot. It's a fascinating opportunity, I think, to see how people think through these topics
Yeah.
and how people make the decisions that they make and like what is it about a journalist, for instance, that you feel like, wow, some people are so curious and they're so interested in asking questions, and other people are so interested in feeling like they're virtuous for not asking questions. So they feel like
Yeah.
this is the time to not
Yeah.
to be the good little boy or good little girl and follow the rules. And so, what is it about people? Like, why is one person
Yeah.
pushing back and another person is submitting? Where is that? And I always ask this question too with related to mainstream news, because I think a lot of people have a misunderstanding of the average journalist. So I'm talking about the people at the very, very top, but the average working bee journalist is not going in editorial meetings saying Pfizer is one of our biggest advertisers, or we got to tout the party line because um we go to the White House Correspondents' Dinner and we don't want to lose our seat, or whatever it is. They're
Yeah.
not saying
Yeah.
it from the perspective of control, like we're going to manipulate the public or we make a ton of money by doing this, or any of the things that a lot of people think. Most of them really are true believers in what they're doing, which I think is more problematic,
Uh-huh.
honestly, but they really believe in
Yeah.
what they're saying. So what's up there? I'm just curious what you think. You're a psychiatrist. Tell us
Yeah.
what's going on in the minds of Americans right now.
So let me give you several thoughts on that. Starting with the journalists who really think that they're being virtuous by suppressing information. And part of that comes from a public health mentality that we begin with the outcome that we want to achieve, and then we shape our messaging using sort of PR tactics to achieve that particular outcome. So if a journalist becomes convinced that the vaccines are safe and effective, meaning for everyone under all circumstances, and the way out of this pandemic, the ticket out of this pandemic, is a needle in every arm, and then the outcome that they want, the outcome that public health officials want them to push, is to overcome vaccine hesitancy, right?
Mhm.
So then the question becomes, how do we frame things? How do we shape things, massage things, spin things, if you want to be cynical about it, to get that outcome? So I think some journalists are concerned about not wanting to do harm, right? And if they come to believe that vaccines are safe and effective for everyone, if I report on anything that might suggest the vaccines sometimes have adverse effects on people, even if those stories are true, it might increase vaccine hesitancy, and then less people are going to be vaccinated, and that might end up harming people. So I think some journalists, um, out of a certain kind of sense of responsibility and a conviction that they already know the answer, won't ask hard questions about safety and efficacy of the vaccines, because they just assume that my job here is to help the general public move toward a particular outcome, which is a needle in every arm, or anything that we need to do to reduce vaccine hesitancy. The problem with that is that journalists need to continue to ask hard questions. We're continuing to learn about these vaccines as we go. New data continues to be published, suggesting, for example, that vaccine efficacy is declining over time, especially against infection. It still protects against severe disease and hospitalization, but there's a lot more breakthrough infections now than there were 6 months ago when we first started vaccinating. So these are things that journalists need to be keeping up on and continually learning about. And if they're not asking hard questions, if they're just sticking to a script that was prepared for them by a public health agency that's going for a particular outcome, or worse yet, a script that's influenced by people that may have a particular financial interest, then they're not actually doing their job as journalists. There's a difference between simplifying scientific information so that a general audience can understand it, and dumbing down scientific information and turning it into a kind of propaganda. aimed at getting a particular behavioral outcome. And I think the latter has no place in journalism. Obviously, journalists have to take complex science and make it understandable for a broad audience, but they can't talk down to that audience. People know when they're being talked down to. People know when they're being subject to propaganda rather than information that allows them to make their own decisions and allows them to make their own judgments. Another factor, Allison, that I think we can't ignore is the financial interests that many of the legacy or mainstream media outlets have and the ties that they have to big pharma by way of advertising dollars. So many people will remember that there was a certain point in time, 15 years ago, where you didn't turn on the TV and see commercials for prescription medications. The ask your doctor about Viagra just was not on TV. And the reason was it was prohibited by law. So pharmaceutical manufacturers could market their products to physicians who are the kind of gatekeepers of prescriptions, but they couldn't market prescription medications to the general public. Now they can. There was a federal law passed that allowed for that. And now every fourth or fifth commercial that you see on TV is for a prescription medication. There's just tremendous revenues for CNN, NBC, Fox, all of the mainstream outlets that's being funneled to them by manufacturers of pharmaceuticals. And it doesn't take much to influence executives at that outlet to be careful about what it is that they publish. Hey, we noticed you had Kheriaty on last week, and we think he's wrong about the Pfizer vaccine for COVID recovered individuals. And here's an expert that you might want to call on next time for a counterpoint. And oh, by the way, my vice president for contracts is going to be reaching out to you about next year's advertising contract. I mean, these sorts of things, they can be subtle or they can be rather overt. But I think it's naive to ignore that that media outlets are not entirely independent of economic interests when it comes to, for example, advertising revenue, which is why alternative media and alternative sources of information like your podcasts and others who are doing independent journalism has become more and more important these days.
Well, it's interesting. I think probably many journalists are not aware that the messaging that it is, like you said, I mean, it's constant messaging. So the normalization of certain narratives, it really is like a change blindness thing. You don't notice that you're also being manipulated by this same narratives that affect other people. You think somehow I don't know where that comes from, if that's like something you're taught in J school, because I didn't study journalism, so I don't know if they're not instructed on that point, but somehow you think maybe you're not a normal person, you have spidey powers or something, and so you're not easily manipulated by these things. And I think they are. I was, when I was in the business, there was a time when I was asleep and I would get the press releases, and I had a doctor on my podcast a few months ago who was a doctor that, there was this big controversy with the Department of Health. And I remember the Department of Health sent out a press release and my bosses were like, just do this. And well, his office is closed. How am I supposed to get a response from him about whether this is true or false? Just say what the Department of Health says and we'll call him tomorrow. And looking back on it, I should have just been like, no, let's just hold the story. But everybody else is doing it. Everybody else is doing it. So we're going to be the only ones in the market that aren't doing it. We need this top of the show at 11. So it doesn't matter. The damage has been done. We get the guy on a day or two later. And it was a mess. And that guy was magnanimous enough to accept my apology for it and come on and talk about what went down and how these government agencies, they're stacked with communications teams. They know exactly what they're doing when it comes to trying to get, like, the FDA stuff around ivermectin is fascinating. The whole like horse thing, and
Yeah,
it just that's just so weird. But they have communications teams that no individual doctor who's questioning them has. So you have to be really skeptical. And I don't know if we were alert enough about that, and the danger that is constantly um promulgated to the journalists and tell you, well, if you fail at this, I can imagine it's kind of similar to medical professionals. Well, what if you get it wrong?
yeah,
Lives are at stake. And the thing is, if you're somebody who questions, you're always at risk of being wrong, right? Because you're asking a question and you're going down a different route. Of course, the people who follow
right,
the establishment narrative are also at risk of being wrong, but no one's going to notice because everybody's saying the wrong thing. So it's much
exactly.
safer to be right, to be the in crowd and also wrong, than to step out and potentially be really right, but also really wrong, and everyone's paying attention. And I think there's a huge amount of pressure to just align, so that you're not the one who's found out to be wrong at some point. So one of my last questions for you: you wrote this op-ed for the Wall Street Journal, "University Vaccine Mandates Violate Medical Ethics. College students aren't guinea pigs." And I'm curious, because we talked about natural immunity, but this seems to be separate from the natural immunity argument and
Yeah.
specific to the vaccine itself. So could you run me through here? Because, like, in other words, let's take natural immunity out of it for a second. Would you still have concerns about the mandates?
I would, and some of those concerns are expressed in that article. That article was written prior to full authorization by the FDA of the Pfizer vaccine. So at that time, all of the vaccines were approved only under emergency use
Mhm.
authorization. The clinical trials for rigorous testing of safety and efficacy of these vaccines were basically cut short after 3 months. And the usual 2 year long rigorous monitoring of safety and efficacy was not done in this case, under pressure to get something out to market during the pandemic, which is understandable, but at the same time had to be balanced against the fact that these vaccines have not been as rigorously tested, and that the passive surveillance systems, the VAERS system, was sending up massive red flags that required ongoing follow-up to assess. At that time, there had been very little investigation of the adverse effects reported in VAERS. The CDC finally investigated the cases of myocarditis that had been reported up to that point, inflammation of the heart, and the CDC actually confirmed that those cases were related to the vaccine, and that, in fact, younger people were at higher risk of myocarditis, and especially younger men. So that piece tried to draw our attention to the fact that these vaccines were still being tested, and that the central principle of all experimentation with human beings, human subjects, is informed consent, which is obviously incompatible with mandates. Now, the counter argument to that piece now is, well, the FDA has fully authorized the Pfizer vaccine. I would enter the caveat that yes, they have done so, but still with far less data than we would ordinarily have for the authorization of a vaccine. So there's still an argument about whether this has been rigorously tested, and there's certainly an argument about what are the long-term risks, and what about long-term efficacy. So since I published that piece, we have a lot more data that efficacy of these vaccines declines starting at about 4 months, and by 6 or 7 months, the efficacy is significantly lower than what we initially anticipated, and significantly lower than what was in the data that was submitted to the FDA. So we're still learning about these vaccines. Um, there's still a lot that we don't know. There are still a lot of signals that, granted, require a lot more investigation to figure out, is this just a correlation, or is this actually caused by the vaccine? But there are signals that there may be safety issues that we didn't recognize in the initial clinical trials. And those are going to require ongoing investigation. And so the idea that at this stage we can mandate a vaccine, I think, continues to be problematic. And I think most of the arguments that I deployed in that Wall Street Journal piece still hold up, even though one of the vaccines has been fully authorized by the FDA.
Are you aware if you're the only one that is filing a lawsuit against that school system in particular, or are there others?
So I don't think there are any others against the University of California, but there was a similar suit against George Mason University filed
Mhm.
by a law professor, Todd Zawicki, who I had lunch with a couple of weeks ago. And he prevailed in that suit. The university ended up granting him a permanent medical exemption, and that set a precedent for others with natural immunity at that school to likewise get a similar exemption. So he was able to prevail in that lawsuit. I have seen, even in the last week, a number of lawsuits again challenging the federal mandate, challenging some state and local mandates. So police
Mhm.
officers and firefighters have filed lawsuits in California against the cities or counties that were mandating vaccines for them. So since my suit has been filed, I think we've seen an uptick of lawsuits challenging vaccine mandates, and I think eventually this is an issue that, as these cases wind their way through the district courts and the appellate courts, the circuit courts, eventually the Supreme Court may have to weigh in
Mhm.
on the constitutionality of these mandates and what are the limits to the kinds of things that can be mandated.
What do you think happens to all the people who lose their jobs in the meantime? Like, what do or do you think they get their jobs back someday? Or how do you think this changes? I know this isn't really a psychiatry question, but I'm just
No,
curious because as people like you and others are working out their cases, there are real consequences in the meantime. I foresee potentially it changes the economy drastically in this country, depending on how it shakes out. But I'm just curious, what do you think?
no.
Do these people have then some kind of class action, or do they get hired back, or do they say, never mind, you can't fire me, I quit anyway, I really wanted to be a dancer in the circus? I just don't know where this ends.
I don't know either. I don't have a crystal ball. I do know that right now there are deadlines looming for a lot of folks. I know a lot of, for example, a lot of nurses at various hospitals are prepared to
Mhm.
walk if this is forced on them. They put their health and their lives at risk on the front lines fighting COVID for the last year and a half, taking care of sick patients, many of them with natural immunity now because they were infected with COVID, many of them for various medical or religious reasons, not wanting the vaccines. And hospitals may encounter a real crisis in the next couple of months if too many staff up and leave over these coercive mandates. And that may result in a backing off of some of these mandates just to allow these hospitals to survive. It's not easy to replace someone like a nurse who requires, a lot of training to be equipped to work in a setting like a hospital. I hope that within a year or two, we realize that the folly of these mandates, and we're able to roll back some of this, and some of those folks are able to return to work, who have been unjustly, I would argue, unjustly let go from their jobs. I don't know that that will happen, um, but I hold out hope that in retrospect, we can see that out of fear or out of misplaced um, public health policies, we ended up harming a lot of people in the process. I think the biggest danger is, I mean, you can imagine losing your job over something like this. This is a person whose trust is probably never going to be regained by public health officials.
Mm.
Um, for a short-term gain of nudging some people to get vaccinated, because basically you're threatening them with extremely severe penalties, that
Mhm.
short-term gain, I think, is going to be more than offset by long-term loss of trust of many, many people.
Yeah.
And by the way, I've had many people reaching out to me who are in the pro-vaccine, anti-mandate camp, right? Who say, I already got vaccinated. I thought the vaccine was a good idea for me, but I don't think
Right.
anyone else should be forced to do this. I
Yeah.
deliberated a lot. I went back and forth on it, and I made the decision to get vaccinated. But if I would have come to another decision, I would have wanted that to have been respected. So even those folks, many of
Mhm.
whom are vaccinated, many of whom got vaccinated under threat of losing their job, and this is the only way I can support my family, their trust is going to be harmed, and in many cases, irreparably harmed by these kinds of public policies. And it's going to take a very long time for medicine, for public health officials, for many uh, companies, employers, governmental leaders to reestablish trust of people that have been harmed by these policies. And
Mhm.
I think that the long term consequences of this are not going to be good. I think we'll look back on this in hopefully in a few years and recognize that many of our policies during COVID were, were short sighted, and we engaged in a lot of folly that we should have been wiser and more prudent about at the time.
And I think we were already at a crisis of trust with institutions
Yes.
anyway before we even got here with the judicial system. And
Yeah.
so I think, yeah, right now, I think a lot of people have a significant amount of distrust with big, like the big companies or big government or whatever you want to say, that whoever is pulling the puppet strings right now. Like you said, I was concerned, and I think one of the reasons that I started doing media analysis on my channel, because I used to do very non-controversial Airstream renovation on my YouTube channel, which doesn't get you suspended, as it turns out, and is an easy way to make money. Versus getting demonetized and suspended all the time, which is
Yeah.
what I do now. I don't know what kind of glutton for punishment I am, but I started talking about it because I really did foresee how the shift in mainstream news under Trump was and actually the New York Times called it. I don't know if they meant to, but they sort of showed their cards back when they ran this story about how that Trump was challenging their rules of objectivity, and they just have to do journalism differently now because the threat
Yeah.
is so unique. And I think that was reflective of a lot of the legacy
Yeah.
press. Well, at the end of their article, I remember them saying, now this may increase distrust, but well, we just still have to do it. But they called it because it did.
Yeah.
After 4 years of
Yep.
just constant pounding, the just hysteria and danger and all this stuff. At the end, you have people who are, weren't like, oh, God, they convinced me. Yeah, the people who you were preaching to, you got them all whipped up and they're on board. But the people
Yeah.
who, were kind of middle of the road, I hear from those people all the time who are just like, man, I didn't like Trump, and I was kind of like already a skeptic of mainstream press anyway, but they just drove me away because I just couldn't watch that
Yeah.
stuff anymore. It was just like, and I hear that a lot. And so there was a significant amount of distrust created with that hysteria for 4 straight years. And then you get to this and it's just amplifying it more and more. And so yeah, I see it trickling out. I don't think people trust the judicial process anymore. I don't think that they trust the government and the election process anymore. I don't think people are trusting public health anymore. I don't want to say everybody, but a significant portion, maybe even
Sure.
half the country. And that's a
Yeah.
lot of people. And I think unfortunately the other half thinks it's because they just don't know better. They're just uneducated. They just don't know better. And I think that's one of the big inaccuracies of many journalists. I have a friend, I'll never forget, at the beginning of the pandemic. She's like, no, I mean, I understand why people are distrustful because they just don't know. And I wrote back and I'm like, no, actually they do know. That's the problem. And that's why your tactics of continuing to suppress information is not working, because they actually know more than you. Now
Hmm.
it's possible they could be wrong, but it's not because they don't know. It's because,
Yeah.
you guys are living in alternate realities. And to just say they just don't know, what they don't, just not uneducated is it totally inaccurate, but that's the way it's looked at.
the group in the United States that has the highest rate of vaccine hesitancy is actually people with PhDs.
I saw that, yeah.
It's it's not low information people, it's high information people. And just a comment on your remarks on journalism, which I think are correct. I was at a dinner party a couple weeks ago and talked to two journalists there, one older and seasoned, another pretty fresh out of journalism school. And the way that journalists are educated, and the way that they understand what it is that they do has changed in the
Mhm,
last 10 to 20 years, such that the idea that we have to get both sides of the story, um, and kind of present a balanced pro con on issues that are, at least issues that are controversial,
mhm.
has given way to the idea that our role is to be advocates. Our
Yes.
role is to advocate for a certain view of
Mhm,
justice or a certain view of society, and that's what it means to be a virtuous physician.
mhm.
I'm sorry, a virtuous journalist.
They
That
probably
must
see
have been a
themselves at the level.
Freudian slip there. So I thought I talking to this older, more seasoned journalist and this younger journalist was helpful in helping me to see the way that journalism has shifted, and it's totally consistent just with what I've seen as a consumer or viewer of journalism in my own lifetime.
Mhm. Totally, and I think social media has really aggravated the situation because you really can stroke your ego and become your own brand now, and you don't become your own brand by just saying boring things that reflect statistics or something. You become your own
Right.
brand by getting into wars with people on Twitter
Yeah.
and dunking on folks and can you believe this dummy in the
Yeah.
hospital said this? They didn't get vaccinated and now they're in the hospital, and then you just put some stupid soundbite and so yeah, you don't grow a brand by being like the old school kind of journalist anymore, and it's all about brand now. Um I don't know how mainstream news repairs itself at this point. The system itself is set up for failure because so even if you're somebody like I consider myself somebody who no question was ignorant of a lot of stuff when I was in the business. But my heart was in the right place. I wanted to know,
Yeah.
but I was given no time really and resources to do the job I needed to do. And so eventually what my crisis of conscience was at the end was that I finally had amassed enough knowledge in the business of what I didn't know, and I was then also aware of how I was never going to be able to pursue those questions. And so then I was like,
Yeah.
well, then I can't stay. So I just think the system is set up so that even the most well-intentioned journalists just do
Yeah.
not have the resources that they need to do their jobs, and why it stays that way, anybody can take a guess. Okay, but I did want to go back to your Twitter account so everybody can follow you and keep up with you. Obviously we showed your Substack earlier, but it's just a Kheriaty, right? uh on Twitter.
That's
That's who
right.
you Okay. So they can keep up with you and you post your articles and stuff. Okay, last final question. Since you are in academics, I'm curious what kind of reaction you've gotten from your peers. Not just academic, but also the medical professionals. Do they think you're nuts? Do they think you've just fallen off the cliff, or do you get agreement from them as well?
So I've I've gotten both reactions, certainly. I have some wonderful colleagues at UCI who may or may not agree with my position on natural immunity or the vaccine mandates, but there's mutual respect, and they know that I'm an intelligent guy and not crazy and reckless, and wouldn't do this if I didn't think there was a really good reason to do this. I think most people understand I'm taking a professional risk here. I have nothing personal to gain and a lot to lose by this lawsuit. There's no financial compensation that I'm seeking by means of this lawsuit. I just want the university to change its policy in order to recognize this group of people who have very reasonable arguments for not needing the vaccine. But I know there's folks out there murmuring and probably think that I may have gone off the cliff. But there's also a lot of folks from within the University of California system and outside the system who have reached out to me, encouraging me, supporting me, asking how they can support the lawsuit. Many of them are medical professionals that are skeptical and trying to ask questions and trying to dig deeper on some of what they're being told or some of the policy positions that have been taken where they're practicing. So I would say a wide range of opinions on this issue, but I've been surprised and edified for every one kind of hate mail I've received. You're an idiot. What are you doing? There are probably 40 or 50 emails of people encouraging me, telling their story. I've had people, perfect strangers, leaving voicemails for me, and crying on the phone. They're so moved
Mm.
by this. Many of them, again, feeling pressured because they're in danger of losing their job. So I have to say I've been quite surprised and edified by just how much support I've received from people I know, but also many, many folks that I don't know, because of my actions and my willingness to stick my neck out on this issue.
Well, and hopefully, if you ever get to the point where you're having a nervous breakdown and need counseling, you have plenty of, colleagues who can help you
There you
out.
go. Yeah, exactly.
Okay, Dr. Kheriaty, thank you so much. I really appreciate it. I learned a lot.
Thanks, Allison.